Hi there. Welcome back to another episode of the Healing Medicine Show. The vision for this show is to provide healthcare professionals with resources and inspiration for both personal and professional development practices, especially those that are rooted in holistic health. We believe that change in healthcare starts by focusing on the health and the healing of healthcare providers. I am very excited to announce our 2024 Women's Wellness Retreat scheduled for February 3rd through the 10th, 2024 in beautiful Costa Rica. So if you're interested in joining us for a week of wellness in paradise, check out the link in the comments below or send me a direct message and we can set something up. So today on the Healing Medicine Show, I'm very excited to welcome one of my longtime friends, a fellow pharmapreneur, Melody Hartzler, who is CEO and founder of Farm to Table. Melody, thank you so much for joining us.
Yeah, thanks for having me. It's good to chat with you and catch up. It's been a while. I think the last time we really talked was like a year ago when you came to our event in Nashville.
Yes, and you just recently had that live event with the Functional Medicine Symposium in Nashville again, right?
Yes. So yeah, we hosted that alongside Orthomolecular Products and FMPHA. So it was a really great time. We had about 80 pharmacists join us. And so it was fun to see the energy and just know that these pharmacists are taking this information back to their practices and being able to implement that with patients and really just help patients get well. Like you said, like it's all, and themselves too. I think a lot of times when pharmacists get into this space, it's because of their own health story.
Absolutely. I know that's how I got into this space, and that's how you and I connected. So you work with patients, you educate pharmacists and other healthcare professionals. You've got an online symposium coming up in November that we're going to talk about on men's health, a topic that we don't really get to explore all that much. But first, I just want to start this conversation by really getting to know you a little bit better. How did you get into functional medicine, and how did your personal health journey kind of maybe shift your awareness in what we can be doing to help our patients actually heal from their conditions?
Yeah. So my background is in ambulatory care and primary care. So I spent most of my career working with patients, and I still do work with patients with type 2 diabetes and metabolic syndrome. So I trained in the VA system, which was an awesome place to start because pharmacists had the ability to write orders, start new meds, take meds away, monitor them. But we didn't have, it was just like at the time, dating myself, but this was 2009, 2010. We didn't have a lot of these newer drug agents. And so we were titrating lots of insulin, talking about carb counting. And at some point I was like, oh man, I don't know if I can do this for 20 or 30 years, right? Continuing the conversation about just getting people to eat less carbs, getting them to change their diet. But as I started to continue in primary care, so I became a faculty member at Cedarville University and helped launch the pharmacy school there. And part of that role, I practiced a couple of days a week in a federally qualified healthcare center. And so there, I tried not to be a diabetes specialist actually, because I was like I said, tired of the insulin titration. And it was my first lesson in a needs assessment for your practice or your business, because I went and became an asthma educator and came back to the clinic, and all the asthma patients were being taken care of great by the local pulmonology residency program at the Children's Hospital. And they didn't really need my help as much as the patients with diabetes. So I fell back into the diabetes role, and also where patients in that clinic didn't have a lot of opportunity to see a nutritionist or a dietitian. And if they did, that appointment was across town that they had to take multiple buses to. Or even if they went there and got that appointment with a dietitian, they were being told a lot of information that wasn't helping their blood sugars. They were being told, oh, you can eat 75 grams of carbs per meal. And to them, a carb is a carb. So they would be, just eating whatever. And their blood sugars wouldn't be getting better. And so I learned over time, I'm like, okay, this food is impacting their blood sugar control, right? And so I started to see in the patients, like the patients that are actually, decreasing the carb, count, maybe eating more whole foods, have better control. And then over this next several years, we started to get continuous glucose monitoring, so we could actually see what was happening all the time instead of just these logs that half the time people are making up and writing. Yeah. They always ended in 0 and 5. I knew that this was made up. So during that time, I became a mom and started to have some of my own health issues. So I actually just recorded a podcast about my birth story with another fellow health practitioner, health coach that had a birth story sort of set off her functional medicine journey as well. But But basically sort of a somewhat traumatic experience with a birth story. And then, lots of like poor sleep during that initial time. I just feel like it was like the nail in the coffin, sort of like leading up to, having a somewhat stressful career, somewhat stressful, college experience. And then the nutrition that I was eating and things probably didn't really line up. I probably had too many antibiotics as a kid, like all of those timeline things with functional medicine that we talk about. But then I started to have a lot of bloating and saw a lot of the symptoms of SIBO. And so finally, after I nursed my daughter for like 13 months, I stopped so I could try to take care of the gut stuff because I knew that I couldn't do antimicrobials or things like that while I was nursing her. So I took care of that in one piece, worked on that. And it was various practitioners before I really figured out what was going on. But then my hormones were a mess. They were like postmenopausal when I was like 6 months out from breastfeeding, like hadn't really started cycling again, the stress, everything going on. She started to have food allergies. So I started sort of connecting the dots between the gut microbiome and the intestinal permeability and all of that. So when that was stressful as a mom to like feed your kid a food and be just like in that fight or flight response, knowing, are they going to react or not going to react? But everything just sort of like, combined there. So I went to one physician who I still see once in a while, who's here in Ohio. And she was like, you're not getting your hormones back unless you try acupuncture. And I was like, oh, okay. Like I can do acupuncture. I'm not scared of needles. And so I went and did acupuncture. I started some Vitex chaste tree type things at the same time, some helping to with the hormones. And yeah, I got my cycle back in a couple months and ended up getting pregnant with my son later that year. And so it was just, a lot of learning on my own journey, a lot of reading and digging, because we do go to providers and everyone was sort of learning. I mean, there was people that have been doing this for 20, 30 years, but there's it's just become way more in the mainstream, I think in the last maybe 5 or 10 years. So during that time, I also started to think like, how is this like with my patients? I keep seeing these women coming into the clinic. At this point, I was in a traditional family medicine private practice with several physicians and other mid-level providers. And so we had more of an insurance population instead of the FQHC that was more of like a Medicaid population. So we had more insured patients and then also our private insured patients and then also Medicare population. But a lot of the women I was seeing with diabetes, they were in their 50s and 60s. They had just gotten diagnosis of diabetes at that menopausal point. So I started to connect the dots with the hormones and the blood sugar control. And then also a lot of them were bloated and had diarrhea. They had chronic constipation. They'd had their gallbladder removed. And so I started to put the dots together too with the gut microbiome and how that's impacting our blood sugar control and the hormone cascade and really like viewing the gut as like an endocrine organ as well. So I spent 6 years there. I had a fellow nurse practitioner, a colleague that was a nurse practitioner in the office that started we started sort of together recruiting functional medicine type patients to that practice. And just sort of learned together. She went through IFM at the time. I had little kids. And so I was doing podcasts and, listening to all these things, reading as much as I could. So we definitely sort of grew together and learned. So it was a really cool opportunity. And the physician that was the owner of the practice was definitely really open to, letting us do that. And I think that is the challenge for some people in the ambulatory care space, especially if you're in a healthcare system that there's very guideline driven type things going on. It might not be as easy to sort of start implementing some of those, but we started gut testing, nutrient depletion testing, all of those things. So at that point, around 2000, I can't remember when I actually did. I did a presentation at ASHP. So I used to speak at mid-year quite a bit. When I was faculty, I was involved in some of the committees and things like that with ASHP. And I did a presentation with a couple other diabetes colleagues that actually, we were talking about prediabetes. And so one of them was reviewing the data for like the drugs in prediabetes. And one of them, I think I forget what the third section was, but my section was about prediabetes and like natural ways to help reverse diabetes. So of course we talked about diet, but I also included like probiotics and prebiotics and this connection to intestinal hyperpermeability and diabetes. And so I had like a line out the door, like ready to ask questions at the end. And like there was another session coming in. And so I'm standing outside this room trying to like talk to all these people that are interested. And that was the first like moment where I was like, okay, people are really interested in this. And even if it's just a line of 10 people that came to my presentation today, like I know there's a lot more of these same pharmacists that are also interested in helping themselves, because a lot of the questions people were asking were about themselves, right? And then also their patients. And so So I started to submit to some other national organizations, including ASHP, several times for content similar to this. And Lindsay Elmore was actually one of the people that I would submit with too, because she was also involved with the ASHP as a faculty member, and when she was working in a clinical pharmacy role. But we kept getting rejected, saying no one was interested in this. And, they send out those surveys saying like, would you like to, hear a talk on this or this or this? And I'm like, people are interested because people are asking me every day, like, where do I get continuing education on this topic? Or, I see this program out there, but it doesn't have continuing education. So I'm spending a lot of money without being able to satisfy my CE requirements. So that was when my light bulb went off. I was like, well, my husband's a web developer and I know like the content that we need to cover. Now, do I want to teach it all? Not necessarily. So we started to look at other people like being faculty members on our programs. But so in fall of 2019, we launched, in the summer, we launched the website, but functionalmedicinece.com. And that is where we had this 1-day event. So first time intro to functional medicine. We had discussions on nutrient depletions. I did a session on gut health. We had hormone discussion, all of the things, sort of just an overview. And it was really well received. And then over the years, we've sort of continued to provide virtual education. So now, what it looks like now is we have a couple virtual programs a year that are included in our annual pass. And then we also have on-demand education that goes out every couple months. So typically there's about over 20 hours of CE available throughout the year for pharmacists to take advantage of. And then in addition to that, people can join us in person. Like we mentioned, we do a one time a year in-person meeting. We're actually doing a cruise next summer, which I don't think I told you about. So maybe you can, maybe you can join us. We're doing it in July. So we're doing a lifestyle medicine cruise. This will be our first attempt at a cruise, and it's Alaskan cruise. So fun fact about me, I've been to 49 out of 50 states. Alaska is the one place I have not been. So we are going to Alaska on a cruise. And so a lot of my team will be there. We're going to, hope that other pharmacists are joining us and we're also going to bring in some like HR people, some brokers, try to get other people educated more about functional medicine, so that because we're really trying to expand not just like our business on the farm to table side, instead of just fee for service with patients, expanding to doing employer health programs and helping even helping other employer health programs, have the team to do the clinical part. So that's part of our growth on the farm to table side. But yeah, so we're just, really our goal as we started to see that pharmacists were really interested in functional medicine and learning more about functional medicine. A lot of them were then asking the question, how do I do this? How do I put this into practice? And for a lot of people, they couldn't just go to indeed.com and like look up a functional pharmacist position. They had to start a business. And not everyone wants to be a business owner, and that there's hard days and there's good days where you're like, yes, this is great. And then the next day you're like, oh my goodness, I don't want to do this anymore. So I think that was a lot of like the draw for people to join our team, was because they wanted to do this in a collection, because everyone was sort of trying to do the same thing. They were trying to make the same sort of social media posts or same videos or same courses they wanted to create. And so, and a lot of our team like have other jobs where they're still, practicing a hospital a couple days a week, or a pharmacy, or whatever that looks like for them. Maybe they're doing prior authorizations for a company a couple days a week, but they still want that patient care aspect and really a way that they can do functional medicine. And so that's really where the farm to table team came. And we took the money that we made in our first conference and invested it into this platform that we use. And we actually have the ability for pharmacists outside of our team to use our platform as an EHR solution as well. But we have a network of physicians that are licensed in all of the states that can sign off on labs. So that really helps with our scope of practice for labs. And then also the patients can use insurance for a lot of their standard labs. We do a lot of labs at just traditional lab places, in addition to the functional medicine testing labs. So we just sort of have emerged, and, and it's always been like, okay, what is the need? And you talk about this a lot when you're looking for like, a business idea, or you want to see what's going on. It's like, you're trying to find a solution to a problem. And for me, the first problem was that pharmacists didn't have enough education in functional medicine, and they weren't getting continuing education credits for it. And then the second problem was that they're like, okay, well, now what do I do with this? How do I use this? How do I see patients? What platform do I use? And that sort of, and how do I do this not on my own? So that's where we are today. And we have about 40 pharmacists on the team across the country that are licensed. And I think we have about 45 states covered. I think we have about 5 states missing on our licensure.
Wow.
But yeah.
Congratulations.
So it's been a fun journey. And I think like the best part of it is doing it with other people, is not being able to like have to figure this all out. Because when I first started, I was like, well, yeah, I could create a business. I could see patients all week. I could, do that on my own. But then I'm only one person that has this, limit of the number of hours that I can physically help people. Whereas if we're, doing this as a team, I can, have influence on, their growth as a provider and, their education. So all of our team members like do all of our functional medicine CE as part of them being on the team. So yeah, so it's just been a really cool journey. And I think the relationships with these so far are all women, and we're not biased towards just women, but I think women just generally, and we're going to talk about the women versus men in the healthcare system and as well, but they just tend to gravitate towards that community, I think, a little bit more sometimes. So, but yeah.
Yeah, absolutely. And I think, you talked about your birth story and mine was very similar. I think, after the birth of my second child, he was born with a very deep sacral dimple, like almost spina bifida. It wasn't open. It wasn't an open neural tube, but it was definitely like close.
Yeah.
And I thought, I was on folic acid and prenatal vitamins my entire pregnancy.
Yeah.
Like what's going on? And it was actually a nutrigenomics, the lab test that showed that I had the MTHFR variation and couldn't methylate folic acid. So it wasn't doing me any good. So I love that you mentioned that your own journey really started with your own personal healing. And, I think many of us going through pharmacy school or medical school or nursing school, we really weren't taught of cures. And I had this conversation with someone. I was at an art gallery opening of all places here in Arkansas the other day. And I said something about diabetes being reversible. And the guy looked at me like I was crazy. What do you mean diabetes is reversible? I was like, yeah, diabetes is reversible. You can. Yeah. And so, I think that people, with metabolic syndrome, with irritable bowel, who are being diagnosed with these conditions haven't heard from the healthcare system that there is hope of reversing these conditions. I think they're asking for more medications to treat these conditions because they're not even aware that they have other options.
Yeah, exactly.
So that's what's exciting to me about what you're doing.
Yeah. And IBS is like a perfect example because like, it's just like a title that says you have a collection of symptoms, right? It's not even like saying that this, like,
your
it doesn't even tell you.
Agree with you.
Right. Yeah. Like you have diarrhea, constipation, bloating, abdominal pain, and you have it for this long. And all of a sudden you have, it's mixed or constipated predominant or diarrhea predominant. It's just describing your symptoms. It's not telling you if you have small intestinal bacterial overgrowth, which is the most common cause of the diarrhea predominant. It's not telling you what your microbiome looks like or if that's contributing, or if you have intestinal permeability, or if you have food sensitivities or celiac or any of that. I mean, the mainstream GI providers will screen for celiac, but sometimes if it's not like a straight up case where it's like diarrhea all the time, sometimes they miss that too. And they don't do, the full out screening and genetic look at that. So some people are just presenting in different ways with their reaction. So I think, to tell people like, I can get rid of your bloating symptoms, so that's not happening to you all the time. They're just like, what? Like, so, yeah. And I would say a lot of people with IBS, like sometimes they go up and down, like they have, times where they go on patient goes on a cruise and they eat all the food and they come back and they're like, or more stress. Yes. Stress. And I have that too. There's times where, things like flare up and you're like, oh crap, I got to get things back in check. But I think that's just our body telling us like it's out of balance and it needs to come back to balance, whether it's through, stress reduction or addressing the nutrients in the diet and things like that. So yeah. And with diabetes too. Yeah. I mean, I think it's amazing even watching the type 1 research in prevention, and even like there's a new drug out there that it's an antibody type treatment that helps to basically, so if someone's at risk for type 1, they already have, it's Tzield is the name of the drug, but it is a brand name, but it is made from a company called Prevention Bio. And so they're actually looking at autoimmune diseases from this like prevention lens. And so people can take it if they have the antibodies positive and they have the like starting to see high glucose after meals, not full overt type type 1. It's not approved for that yet. Like they've presented with DKA, but they are doing studies where patients present with DKA. And then within so many weeks, they can get the infusions. But that study, I don't think that data is released yet. But so even watching like that and like seeing like the pharma, you know, this is a big pharma company or small pharma company. It's a small company, but like actually dig into some of this, like, and how, like, what's the root cause of here? And they're studying like a vaccine for a virus that contributes to stimulating type 1 diabetes. And for, you know, especially for those at-risk people, you know, I watched my patients, dad has diabetes, son has diabetes, like, you know, it's just becoming like sort of this generational thing. And certainly, you know, there's a lot of factors in that with, you know, microbiome and epigenetics versus, you know, their genetics and things like that. But yeah, type 2 patients, I mean, the thing about it is reversing it as early as possible because we have the metabolic memory, and the longer it goes on, the harder it's going to be to reverse. So, but yes, I mean, I think that is a hard thing because we're taught in school that like, oh, this is a progressive disease. Your beta cell declines over the years. Like we've all seen that graph where you're 50% of your beta cell function at type 2 diagnosis, and we've seen that line just go down. But yeah, it's definitely possible with lifestyle change. And sometimes it takes a more radical change for some people than others, like I said, depending on the extent of the cause. And I think one of the biggest challenges is the toxin component of metabolic syndrome. And like, we know Agent Orange is like causes severe insulin resistance. And like the VA pays for every single person that was ever exposed to Agent Orange and all of their diabetes care. But like, what other chemicals are around? Like, you know, my guy that's working in this like tire factory, like, and now has diabetes, but doesn't look like a type 2, but he's not type 1. And like, so it's just like, it's, you know, a lot of stuff to think about for providers, but I think that's why, you know, the more you're learning, the more these things are going through your brain of like, what else is going on in this person besides the straight, like, it's just your food, because it's not always just their food. Yeah. So I probably went off on a tangent there.
Well, I think just being open to the idea that there are other ways of healing and of practicing that's out there that people are doing. So, you know, we learned this is what medicine you give for constipation, but changing that conversation to how much water do you drink every day? What are you eating? What's your movement, you know, like on a daily basis is really what can begin to shift that. And you touched on autoimmune and inflammation, and you've got this online CE coming up in November on men's health, which is definitely something that we don't get to talk about a lot. You know, men's health, we think ED and, you know, testosterone supplements and that's kind of it. But there's so much more to it. So talk to me a little bit about what we can expect on that online summit in November.
Yeah. It's interesting because we know like there are so many more women. I think I saw one statistic that was like 78% of the healthcare system is women at this point, which is sort of mind blowing considering it was all men in the previous.
Right.
And we
years ago, it was
pretty quickly transitioned to the male or to the women being more predominant. And I think about pharmacy school too, even in, you know, 2009 we had more women than men. And then as far as like life expectancy as well, and like this longevity conversation, women are also living longer than men. And that gap, like in the early 1900s was only like 2 years. And now it's data based on, this is from a source from the National Center for Health Statistics, is 5 years difference in 2017. So it'd be interesting to see even a more updated one. So some of that is, you know, maybe related to hormones and differences there, but like as it keeps widening, it's like, okay, what else is going on here that men are experiencing differently in their view and their roles in this world. So certainly, you know, the biological factors, like I mentioned, this, you know, their sex chromosomes, their hormones, even their metabolism may be a little bit different. But even some of the social pieces, and we'll get into this in some of the lifestyle conversations, but work stress things, and sometimes lack of social networks and support. Like again, I mentioned already about women like desiring community a little bit more just because of our inherent nature. And I think men, especially men that are not involved in like a faith group, because I see men in like, you know, in churches and things, like tend to have like a little bit more of that community support. But outside of that, you know, unless you're, you know, if you're a dad, you've got kids, you're, you know, doing your job 40, 50 hours a week, like what are they doing to like get out and engage with people in like a more social setting? I mean, sometimes it's going to a bar at the end of the week or having a happy hour. But I find a lot of men, it tends to be more business conversations that some of those things are happening in, and not actually like was about your life, like
life
asking,
stuff.
asking them to, what are you struggling with? And what are you, what do you need help with? What do you need support in? Like those kinds of questions. Men don't tend to like dig into each other's lives as easily. And so I think that piece is probably a component of this more loneliness. And we've seen numbers of, suicides and things like that and go up to in men. So community is a pillar of health. And so I think that is probably one of the big differences here. But then there's also, more like men are more likely to be smokers or using alcohol or substance abuse, maybe have a lack of exercise and even the lack of routine medical care. Oftentimes they're way less likely to enter the medical system for things until it's gotten to a point where it's, really bad compared to women, and less likely to be proactive. So I think there's like a lot of pieces there. And a lot of our patients, that are coming in the doors, obviously we have a majority of women, coming for the healthcare system. But I think because a lot of us in this functional medicine journey have learned on our own, like we've learned about ourselves or we've learned about our kids, and taken courses and all these things. I feel like there probably is a lack of education on men and like how to take care of them when they come in your doors.
How to talk to them too.
Yeah, exactly.
I think about health coaching has completely changed the way that I have conversations with patients. It's not, you should be doing this, you shouldn't be eating that. It's really what is important to you about your health. What health goals do you have? And maybe it's, I want to stay active enough that I can still go fishing on my own.
Right. Exactly.
So understanding what's important to the patient, I think it's very important for us as the caregiver or the healthcare provider.
Yeah, I'll never forget. I did in the Federally Qualified Healthcare Center, I did a group diabetes appointment where I had like a resident physician working with me that I was helping to train. And we had about 7 to 10, we actually have a publication on it, but 7 to 10 patients at the same time. And we went around, we had a psychologist that was involved too. So she, had sort of, we were talking about stages of change and theory, and we sort of asked everyone, like, what's your why bother question? Why bother taking care of your diabetes? And one man who, he had a rough life. I think he had hepatitis. He had like been involved with drug use. He had like a mitral valve replacement. So he was on anticoagulation, like all of this stuff going on. But he sat there and he just smiled and said, I bother because I want to see the stars at night. And I was just like, oh my goodness. Like, I just never forget like his face and just like how he was just like, I want to see, this and wake up to this. And I was like, okay. So some people's motivation is their grandkids or, their kids that they need to be here for. But
it's rarely to get their A1C.
Right. Yeah. Right. Exactly. They're not like, hey, my number needs to be this because it needs to be this. And so that's such an important piece, I think, just in healthcare in general that we miss a lot is the I wish we could have clinical psychologists, health coaches built into every primary care practice because so much of chronic.
We're going to get there. We'll build it.
Yes. Yeah. So much of chronic disease. If other providers are listening and you need support, our team can help. But because there's even ways that, and we talk about this a lot in your courses that you can build in, chronic care management type things with, providers that are doing some of the coaching and behavioral health services. Getting people to getting to know the person is so important and what they want and what they value, I think too. Like if you're talking to someone who values more physical things and that doesn't value their health, then it's going to be a lot bigger challenge getting their A1C under control but helping point out the things or helping them discover the things in their life that they are valuing, like their children or their, relationships, is going to be an important factor into them putting in the work because so much of men's health, which we're going to talk about on November 4th with our speakers is, so much can be lifestyle driven, lifestyle modifications. And yes, there's certain nutrients that from a supplement standpoint may make sense for certain people, but the stress reduction and, all of the nutrition components, even looking at maybe for different patients, biohacking, time restricted eating, intermittent fasting, it's all been, out there in the blogosphere and all the social media and everything. So Lara is going to, do a deep dive into the nutrition for men and how these things really play, because it's different in men versus women as far as a lot of our studies on keto or intermittent fasting are done in men. And so we have a little bit more data about outcomes for them versus women for those things. And then Richard Harris, who is a Pharm D, but also an MD and also has an MBA. So he's just like a super smart guy who is passionate about men's health and lifestyle interventions in particular. So he's going to talk about exercise, the types of exercise, how important sleep is. I mean, I think that's the number one thing a lot of men don't get enough of is sleep. And, I mean, the women too, but or America in general. But I think, that's a really important factor. Like if you're coming to me saying you're sleeping 4 hours a night, like I can't get you well until you get that under control. And men do need a little less sleep than women on average, but it's not 4 hours.
Right.
And then, stress is such a big thing. And I think, it's how we navigate stress. What do we do during the day, and taking those deep breaths and taking those pauses? And maybe men are like, oh, I'm not really interested in yoga, right? They're not as excited about that. So what can we teach them to do that is helpful, whether it's a simple thing like box breathing, whether it's monitoring your heart rate variability on an Aura ring, or, what is it that's going to be the most beneficial to being able to sort of biohack and improve longevity for those patients. So that's sort of like the end of the day things. And then the morning, we're also going to be talking about the connection between meta inflammation. So we talked about the metabolic disease a lot already today, but sort of talking about that and its role in inflammation in men and cardiovascular disease risk and cancer risk and even mortality and COVID type things. And the glycocalyx is like the new buzzword in the cardiology space, I feel like, which is we're going to dive into. We talked about in our sessions in last month with Nashville. I kept wanting to say November, but this is coming November. And Nashville was last month in September. But so that's going to be something that.
And how many CE hours, Melody?
This is 7. So 7. We have,
okay.
3.5 in the morning, 3.5 in the afternoon. And then we also have a session on the workup. So as far as like what labs to do, because that's always a question. People are like, okay, I've got the interventions, but the patient wants labs, or, what do I do with the labs once I get them back? How do I interpret them? What's the most important one to look at? If a patient has a budget, what should I be focusing on? Because we know that the functional medicine lab testing world, you can get into thousands and thousands of dollars and maybe not necessary things. So it's really, I'm really excited because we've done a women's hormone day, and we have not yet done a deep dive into men's health. So it's going to be a really good program.
That's amazing. So we will link the link below, but that's functionalmedicinece.com. I have no doubt I've attended these in the past, and I do need some CE hours. My license renews at the end of December, so I actually probably need to come and get some of those. Yeah, absolutely. I'll be there, and definitely will consider the cruise next July as well.
Yeah, so it's out of Seattle, so it makes it easy to get to as far as versus having to go international to get on the boat. So we're excited about that. But you can also explore Seattle for the day. My husband and I have been there and love the city, so we're going to take the kids for a couple days beforehand and go to all the places.
Fun. Well, Melody, thank you so much for joining us here on the Healing Medicine Show. Like I said, I really appreciate what you're doing, not only for pharmacy, but for healthcare professionals, really getting the word out about functional medicine and how we can use it to drive outcomes and really drive true healing for not only for our patients, but also for ourselves. That's what this show is really about. Those of us on our own health journeys. So thank you so much for what you're doing. And I really appreciate your time.